How often have you heard someone call another person psycho, schizo, bipolar, or OCD? Chances are, those people didn't fully understand the terms they were using. We've discussed the stigma that often surrounds psychological disorders and the individuals who experience them. At the same time, society tends to downplay these disorders, using them casually to describe behaviors or habits that, while unique, are typically within the bounds of healthy functioning. Most of us use these terms without understanding the conditions themselves, which is why we're here, to explore psychological disorders more thoroughly. By delving into the symptoms, classifications, causes, and viewpoints that provide insight into these disorders, we gain a clearer picture of what they truly entail. Anxiety, for instance, is one of the most common root causes of many psychological disorders. Anxiety is a natural part of life, but for some people, it can intensify into overwhelming fear or immobilizing dread, eventually leading to an anxiety disorder. Psychological disorders can be defined by patterns of thoughts, emotions, or actions that are deviant, distressing, and dysfunctional, often interfering with everyday life. In terms of anxiety, this distinction is critical. For instance, there's a difference between someone jokingly called phobic for disliking roller coasters and a person who genuinely feels unable to leave their home due to fear of social interaction. Similarly, there's a distinction between a friend called OCD for their nightly laundry routine and someone who washes their hands so compulsively that it causes them physical harm. Starting today, you'll gain a deeper understanding of these terms. So, what defines an anxiety disorder? While anxiety and fear are often associated, anxiety disorders involve more than just the feeling of fear. A major aspect is the methods people use to alleviate this fear. Take someone who almost drowned as a child and now avoids water. They may isolate themselves at family gatherings by the river to cope, though it might not bring much relief. Clinically, anxiety disorders are marked not only by persistent, distressing anxiety, but also by dysfunctional behaviors developed to manage it. Around 1 in 5 people will experience an anxiety disorder at some point. That's a significant number. Let's start with Obsessive-Compulsive Disorder, OCD, previously classified as an anxiety disorder, but now recognized as distinct. OCD involves intrusive, repetitive thoughts, known as obsessions, often paired with repetitive actions, known as compulsions. OCD exemplifies the need for clarity in understanding mental health. Being tidy or organized doesn't make someone OCD. True OCD is a debilitating condition. Actions like hand washing or checking the stove go from normal habits to compulsions, and individuals use these compulsions to manage severe anxiety. For someone with OCD, these behaviors, washing hands frequently, checking locks, counting steps, can disrupt daily life and are often driven by a consuming fear, such as worrying that a minor oversight could result in catastrophe. Generalized Anxiety Disorder, GAD, is the broadest of these conditions. People with GAD often feel consistently tense and anxious for over 6 months, a level of worry that goes beyond typical daily stress. This worry often lacks a specific cause, making it difficult to avoid or address. People with GAD live in a near-constant state of anxiety, frequently without knowing why. Panic disorder, which affects about 1 in 75 people, involves sudden panic attacks, intense episodes of dread that strike without warning. Unlike GAD, panic attacks are brief but severe. Symptoms include chest pain, rapid heartbeat, and a feeling of losing control, making the experience highly distressing. Panic disorder can be triggered by a traumatic event or prolonged stress, and sometimes the fear of having another panic attack becomes a trigger in itself. When the anxiety manifests as a fear of specific situations or objects, we enter the realm of phobias. Misunderstood for years, true phobias involve more than a dislike of cats or discomfort on long flights. They're irrational, intense fears that lead to avoidance behaviors. For example, people with gyrophobia, fear of bridges, may avoid crossing them entirely. This avoidance can interfere with daily life. as is the case with Maryland's Chesapeake Bay Bridge, where people pay for drivers to help them cross. Anxiety disorders are complex and often overlap, making it difficult to distinguish them. Understanding them involves looking at two main perspectives on causes: the learning perspective and the biological perspective. The learning perspective involves factors like conditioning, observational learning, and cognition. Remember John B. Watson's experiments with little Albert, where he conditioned a young child to fear furry objects? This was done by pairing a loud noise with the sight of a rat, which led Albert to fear not just rats, but all things furry, a concept known as stimulus generalization. Reinforcement also strengthens these fears, as avoidance may provide temporary relief, which only reinforces the phobia. Cognition plays a role as well. How we interpret events impacts our reactions. For instance, whether we perceive a sound as the wind or as something dangerous influences whether we stay calm or react with fear. We can also pick up anxiety through observation, like a parent's fear of water potentially instilling that fear in their child. The biological perspective offers equally important insights. Natural selection, for instance, may explain why we fear animals like snakes or heights. Ancestors who stayed away from these threats survived longer. Genetic studies also show that identical twins are more likely to share phobias, even when raised separately. And researchers have identified genes associated with anxiety disorders. Ultimately, the mind and body are interconnected, and what happens in the brain impacts the psyche. Panic attacks, generalized anxiety, and compulsions all involve parts of the brain related to impulse control and habitual behaviors. It's unclear whether these brain patterns cause the disorder or are a result of it, but they underscore the idea that psychological issues are often rooted in biology. Today, you learned the foundations of anxiety disorders, from OCD to phobias, and explored both the learning and biological perspectives on their origins. Hopefully, you're leaving with a better understanding and a reminder not to use terms like OCD or bipolar casually.